चल रही हूँ and there is extreme pain in the right leg since past 2 years. Actually, I opted for certain orthopedic surgeons as well, consulted them, but the main problem was regarding the technique that they use to operate patients.
Yes.
There were a lot of doctors who were misguiding me in the process. They were like, this pain is going to subside in a while. I was unaware that it is going to be such a huge problem, or I was going to have a problem in the hip back. I do remember I was searching on YouTube about the technique and your video surfaced. It was all random. I was not even trying to look for a doctor in the YouTube search. I was just trying to look at the procedure, what it is going to be. Then your video surfaced. I watched it. And I, just as I told you, I might be the only one who has watched your entire playlist regarding that.
Right.
Also, I might agree on this. I did not expect my hip is going to be better than how it was how it used to be.
So you're happy with all the process?
I am most happy. I'm lucky that I found you. I just want to let the other patients know that do not fall into the trap of these some silly doctors, and do not go for these Ayurvedic and homeopathic.
Hi friends, my name is Dr. D.P. Sharma and I am a MIS hip consultant. आज हमारे साथ patient हैं. Right?
Yes,
What
sir.
is your age?
So 25 years.
25. So what problem are you facing in your hip right now?
Actually, limp मैं करके चल रही हूँ.
Right.
And there is extreme pain in the right leg.
अच्छा. Since when it is happening?
Since past 2 years.
Since past 2 years. It's been a long time.
Yes,
So what all kind of treatments have you sought before coming to us?
So
What all have you tried?
Actually, I opted for certain orthopedic surgeons as well.
Right.
And I consulted them.
Right.
But the main problem was regarding the technique that they use to operate
Definitely.
patients.
Yes.
And then I found about you on the YouTube.
Okay.
And then I came to visit you
Right.
the last
Right.
month.
You came
and
few
then
time
we,
back. Yes.
Mm.
So, like she's saying, we operate with a different technique.
Yes,
It's
sir.
very scientifically proven, better results, and it's very uncommonly done. That's a bad part. कि काफी सारे surgeons को ये बात आती नहीं है. तो we will use a MIS-BIKINI technique in you,
Yes, sir.
जिसमें कि we will not damage anything, and we are also going prepared for a collared implant जो सिंक नहीं हो सकता. So it has a better advantage कि एक तो आपका जो पैर थोड़ा सा छोटा भी हो गया है, शॉर्टनिंग हो गई है, तो उसको हम करेक्ट भी करेंगे, एंड इट हैज नो चांस कि वो अनकरेक्ट हो जाए वापस से. तो इट विल स्टे एज इट इज, और हम अनसीमेंटेड इम्प्लांट्स यूज करेंगे. तो एक बार हम मूवमेंट्स देखते हैं वापस से आपके. इन लाइट डाउन. सो अबाउट 1 सेंटीमीटर के आसपास शॉर्टनिंग है आपको.
Yes, sir.
और इसकी वजह से भी और पेन की वजह से भी 2 कंपोनेंट्स हैं लिम्फ आने के,
Yes, sir.
है ना. या तो वीकनेस हो, या पेन हो, या लिम्फ हो. तो इस साइड में कोई तकलीफ नहीं है.
No,
तो
sir.
ऑल द मूवमेंट्स आर फ्री.
Yes.
और इस साइड में बेंड करते हो
Pain
आप,
है.
पेन है. एंड हाउ मच इज द पेन?
हाँ, too much.
टू
हाँ,
मच, इट्स टू मच. तो रोटेशन भी एक्सटेंडेड है, और ये नहीं ऐसे नीचे जाता,
No, sir.
स्ट्रेच होता है. और ये एबडक्शन में भी, बाहर लाने में भी इसके बाद स्ट्रेचिंग आती है.
No.
ओके. तो पेन होता है, एंड ये वाले रोटेशंस भी आपके रेस्ट्रिक्ट हो रहे हैं.
Yes.
राइट. ठीक है. तो जब आप सुबह उठते हो तो तकलीफ बढ़ जाती है थोड़ी सी,
Yes, sir.
फॉर हाफ एन आवर और समथिंग, एंड देन यू मूव अराउंड, तो ठीक लगता है. ठीक है. तो एक बार हम वॉक करके आपका वीडियो देखेंगे, एक बार स्टेयर्स पे चढ़ के, एंड देन वी विल कंपेयर इट आफ्टर द सर्जरी. ठीक है, आ जाओ मेरी तरफ. ठीक है, कम डाउन. It's been about more than 1 year now,
Yes.
and you came to us with a lot of pain in the right hip, and you were being troubled since 2 years back then.
Yes.
So there are a lot of misconceptions about hip replacement, lot of chaos, lots of information on the internet. Finally, you came to us, we did your Bikini THR. Now, how did that surgery impact your life, and how did you take it? How much fear you had before the surgery? How did it turn out to be? How was everyone accepting at the family? How did they see the result? How did you feel about the result? It's been 1 year now. We've seen you walk comfortably. We've seen you walk
Yes.
do the stairs. So that right hip pain is gone completely. We know about that. तो आपका कैसा experience था? मतलब
I do remember I was diagnosed with all this pain I was having,
Right.
and I was facing a lot of trouble.
Yes.
There were a lot of doctors who were misguiding me in the process.
Yes.
They were like, this pain is going to subside in a while.
Yes.
And I was unaware that it is going to be such a huge problem, or I was going to have a problem in the hip back
So
then.
basically just having painkillers and trying to delay it
Yes.
somehow. So that's what going on for
Also,
months.
a doctor from a very well-reputed hospital,
Right.
he told me that I was having some other disease, and for which he treated me with some pulse steroid treatment.
Yeah,
and
that eventually
continued with
resulted
that.
in this.
And that eventually resulted in almost deteriorating from the
Exactly,
condition that
exactly,
I was in the beginning.
Right.
Then I went for an MRI. It was confirmed that I have
Yes.
stage 3 AVN, I guess.
Yes,
I was
yes,
having back
yes,
then.
yes.
Then I visited a few of doctors. I began scrolling about it.
Right.
And I do remember I was searching on YouTube about the technique,
Mhm.
and your video surfaced
Right.
on that.
Right.
So
Just
I-
random.
Yes.
So no
It
one
was-
recommended you to come to us.
No, it was all random.
Hmm.
I was not even trying to look for a doctor in the YouTube search.
Hmm.
I was just trying to look at the procedure, what it is going to be.
What's
how,
going to be? Yes, yes, yes.
So I was just going to, and then your video surfaced. I watched it, and just as I told you, I might be the only one who has watched your entire playlist regarding that.
Right.
So then I made up my mind.
Right.
I visited you, and I still remember it was the first visit that I visited you, and I was it was fully confirmed that okay, you are going to do it.
Right.
Also, I might agree on this. I did not expect my hip is going to be better than how it was how it used to be.
Used to be, yes,
Huh.
yes. Because there are a lot of
I did not-
things that go in mind. Okay, this is going to be artificial. I might not walk very nicely. So a lot of confusions go around.
No, it is just as how normally in daily life people walk.
Yes, exactly.
It feels the same.
It feels
You
the
are
same.
not going to have any sort of problem in walking,
Exactly.
climbing your stairs, or doing your day-to-day
Right. So,
activities.
so when normal person sees you, you cannot make out that one
No,
hip
no,
is
no,
replaced.
no,
There's
they
no way.
cannot. No, there's no way.
There's no way. Because I cannot make out which one is replaced. So you're happy with all the
I
process.
am most happy. I'm
So
lucky that I found you.
No, that's just being generous. But you're happy with the pain, the technique, the
I
limb,
do
limb
not-
was short as well.
Yes, my
So
leg
we
length was
corrected the
shortened.
leg length as well.
Yes.
And now you're doing almost everything that you do in your daily life.
Yes.
You sat cross-legged as well. So you're walking free.
Hmm.
Okay. And everyone went happy with the family because, usually families are very anxious that, okay, our child is going through such a big
No,
procedure.
I was worried about, initially I was worried about how the process is going to be post-surgery,
Yes.
and how am I going to come back
Come back as a
normal.
rehab. Yes.
And it just took me around 10 or 15 days.
Yes.
I used walker initially.
Yes.
I did not use any stick.
Direct jump.
Direct jump. I used to walk. But generously I did my exercises
Yes.
post-surgery.
Yes.
So they played a major role.
Yes, definitely. Because your muscles were not active since 2 years.
Yes.
So you have to make them active. Now the part rubbing, we just smoothened it up and did not damage any muscles. So they quickly remember. As soon as you do the exercises, they start remembering all your movements and they come back.
Yes.
Right. So we are already giving you medicines for the other part of the bones that might have been damaged because of the steroids. So you're already on that. And we will keep continuing this 6 monthly checkup at least. Right now, everything is healed. Your implant is well in place. It's as perfect as it can be. Okay.
I just want to let the other patients know that do not fall into the trap of these some silly doctors, and do not go for these Ayurvedic and homeopathic doctors.
Because these guys
Once
have been
you-
creating a lot of scams.
Yes. They initially they give you some kind of treatment that you won't feel the pain, and you will feel that the problem which you're having is
It's decreasing. Yes.
But the fact is, they aggravate the problem to another
Exactly.
level.
So
and
recently
makes
it was caught that these guys are giving steroids again because steroids decreases your pain. It's a mood elevator. It elevates your mood. So a lot of patients are being fooled, and we have people spending lakhs on them.
I was under the treatment of the best neurologist one could ask for. And he gave me a pulse steroid treatment for a disease I was not having. I had to suffer for like 6 or 7 months. I still remember I have to suffer for like 6 or 7 months just to find the correct doctor.
Right.
Just to find out what problem I was having initially.
So you went all around and you saw everything, and you had, sadly, you had to waste your time and money.
Yes.
But you would not recommend people having this disease to waste their time and money, because time is invaluable. And then you keep on developing limb.
Also, your muscles are going to be in a position
in that situation for a longer duration.
Yes.
So your limb will take longer time to heal. People come with
The
more
recovery
short
will-
leg.
Yes.
Yes. So friends, we are discussing what happened to this young lady. She came to us with such a severe pain, severe limb. She was barely able to walk freely, barely able to climb the stairs freely. And she had such bad arthritis, and she also had a short leg. So her leg was short because she had been advised different kinds of treatment which were not working for her. If you look at this x-ray, you can find out that the head is completely collapsed. She has high grade AVN with arthritis, and she was wincing in pain, and she had to take so many painkillers apart from other ailments and other disease drugs which she could not avoid, like steroids. So such patients are very, very common in our practice. They usually are misguided by some kind of Ayurvedic treatment or homeopathic treatment. And when they come to us, they are already in a complicated stage. So we did an uncemented hip replacement for her with using the best implants, the shortest stem implants, which use less bone and is now completely pain-free. You can see how confidently she's walking, how confidently she is on her stairs. She's able to sit cross-legged, she's able to sit down, and she is extremely happy. The level of confidence now she has, like, we are really surprised that our technique is giving such good results to the patients. They were in search for a good center, and they were so relieved by coming here. They got the right treatment, and we're really proud of the treatment and the smile we get on patients' face and their families' face. If you're suffering from pain because of joint arthritis, do not hesitate to call us, and we are just a call away from you. Thank you so much, and have a nice day.